Now, today's main story, TB is not a disease that affects all populations equally, and understanding this is actually the key to beating it. We're going to speak to some key people around this topic, but first, some highlights from the plenary.
If we look at the numbers, there's 480,000 estimated cases of multi-drug resistant TB every year. We're only finding 123,000 of those. Of those 123,000 that we're finding, only 111,000 are being put on treatment. Now that's more than 90%, but we really need to be getting to 100. Thankfully, somebody who was successfully treated, not MDR, but XDR-TB, is our first speaker today.
I took the MDR drugs for about 4 months, and there were like 20 tablets a day with an injection called kanamycin. Well, one morning, I woke up and everything was so quiet. I tried to turn on the television, but there was no sign. I went to the bathroom, normal stuff, flushed, there was no sound of raining water. Well, I went to the audiologist. Now the audiologist was talking, I could not hear. Then they had a pad and a pen, then I had to write down. He wrote down in red that deaf. This year, there's a thing that we called Friends of Phumeza. They managed to raise $20,000 to get bilateral cochlear implants. Well, TB most affects the poor. How can we get deaf? How can you afford these things? Well, they helped me with $20,000. 4 months later, on the pre-XDR-TB drugs, they also stopped working. I was told I have XDR-TB, and now my chances of surviving were like really low. Luckily enough, I've met MSF, and they gave me a drug called linezolid. Here in South Africa, we have the problem of patent laws. The drug alone, like one tablet, costs about $60. That's about plus minus 700 rands here in South Africa. The people who need the drug the most can't have access to it because it is expensive. I and the other TB survivors, we went to Parliament, that is in the United Kingdom, in the USA, and here in South Africa. We asked them to assist us with drug-resistant TB. There is a thing called TB and stigma. As you can see here, we need to unmask stigma. So now I ask you to join me in breaking down the stigma. I ask you now to put on the mask. I'll wait for you to put on the mask. Well, by putting on the mask, we are in solidarity with the patient to remind ourselves that behind the mask, we are all the same.